Amino Acids Part 4. Methionine. Methionine is an essential amino acid that assists in the breakdown of fats, thus helping to prevent a buildup of fat in the liver and arteries that might obstruct blood flow to the brain, heart, and kidneys. The synthesis of the amino acids cysteine and taurine may depend on the availability of methionine. Methionine is a powerful antioxidant. It is a good source of sulfur which inactivates free radicals and helps to prevent skin and nail problems. It is also good for people with Gilbert syndrome, an anomaly of liver function, and is required for the synthesis of nucleic acids, collagen, and proteins found in every cell of the body. Ornithine. Ornithine helps to prompt the release of growth hormone, which promotes the metabolism of excess body fat. Ornithine is necessary for proper immune system and liver function. This amino acid also detoxifies ammonia and aids in liver regeneration. Phenylalanine. Phenylalanine is an essential amino acid. Because it can cross the blood-brain barrier, it can have a direct effect on brain chemistry. Once in the body, phenylalanine can be converted into another amino acid, tyrosine, which in turn is used to synthesize two key neurotransmitters that promote alertness, dopamine and norepinephrine. Because of its relationship to the action of the central nervous system, this amino acid can elevate mood, decrease pain, aid in memory and learning, and suppress the appetite. Supplemental phenylalanine, as well as products containing aspartame, should not be taken by women or by people who suffer from anxiety attacks, diabetes, high blood pressure. Praline. Praline improves skin texture by aiding in the production of collagen and reducing the loss of collagen through the aging process. It also helps in the healing of cartilage and the strengthening of joint tendons and heart muscle. It works with vitamin C to promote healthy connective tissue. Praline is obtained primarily from meat sources, dairy products, and eggs. Serine. Serine is needed for the proper metabolism of fats and fatty acids, the growth of muscle, and the maintenance of a healthy immune system. It is a component of brain proteins and the protective myelin sheaths that cover nerve fibers. It is important in RNA and DNA functions, cell membrane formation, and creatine synthesis. It also aids in the production of immunoglobulins and antibodies. However, too high serine levels in the body may have adverse effects on the immune system. Taurine. High concentrations of taurine are found in the heart muscle, white blood cells, skeletal muscle, and central nervous system. It is a building block of all the other amino acids as well as a key component of bile, which is needed for the digestion of fats, the absorption of fat-soluble vitamins, and the control of serum cholesterol levels. Taurine has a protective effect on the brain, particularly if the brain is dehydrated. It is used to treat anxiety, epilepsy, hyperactivity, poor brain function, and seizures. Taurine is found in concentrations up to 4 times greater in the brains of children than in those of adults. It may be that a deficiency of taurine in the developing brain is involved in seizures. Tryptophan. Tryptophan is an essential amino acid that is necessary for the production of vitamin B3. It is used by the brain to produce serotonin, a necessary neurotransmitter that transfers nerve impulses from one cell to another and is responsible for normal sleep. Tryptophan helps to control hyperactivity in children, alleviate stress, is good for the heart, aids in weight control by reducing appetite, and enhances the release of growth hormone. It is good for migraine headaches and may reduce some of the effects of nicotine. Tyrosine. Tyrosine is important to overall metabolism. It is a precursor of adrenaline and the neurotransmitters norepinephrine and dopamine, which regulate mood and stimulate metabolism and the nervous system. Tyrosine acts as a mood elevator. Lack of adequate amounts of tyrosine leads to a deficiency of norepinephrine in the brain, which in turn can result in depression. It also acts as a mild antioxidant, suppresses the appetite, and helps to reduce body fat. It aids in the production of melanin and in the functions of the adrenal, thyroid, and pituitary glands. It is also involved in the metabolism of the amino acid phenylalanine. Persons taking monoamine oxidase MAO inhibitors, commonly prescribed for depression, must strictly limit their intake of foods containing tyrosine and should not take any supplements containing L-tyrosine, as it may lead to a sudden and dangerous rise in blood pressure. Anyone who takes prescription medication for depression should discuss necessary dietary restrictions with his or her physician.